and this is Mugshot Snap, a modern digital Filipino platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot. As the expert, health is a state of body, wellness is a state of being by Jay Stanford. Mga ka-mugshots, welcome to Magpahaba ng Buhay every Tuesday at 6 p.m. Ang episode natin today ay tungkol sa the Boob Job. And ang makakasama natin ngayon ay isang plastic surgeon from the Philippine General Hospital, Dr. Gerald Abisamis. Hi, Doc Gerald!
Hi! Good evening, everyone. Good evening sa lahat ng mga nanonood.
Yeah.
Happy to be here.
Yes. So, Doc, ang dami nating questions about the boob job, yung breast augmentation. Kasi ngayong pandemic, kasi naka-quarantine, parang maraming ang nagko-consider na gawin na ang gusto nilang gawin na pagpapaplastic surgery. Kasi siguro walang nakakakita sa kanila for a long time. Hindi mapapansin. So, I guess yung first question natin, ano ba yung mga different types of breast augmentation o yung pagpapalaki ng suso?
Okay. So, siguro before I discuss the different types of breast augmentation, no? Breast augmentation itself is a type of surgery that enhances the shape and the size of the breast, no? And it's done by different styles or different types. So the first and most common type is the use of implants So implant surgery. The implant surgery can be silicone implant or saline implants or parang water type ng implant, no? But the most common is actually silicone gel filled implants, no? And actually I have samples here to show you. So this is a type of a silicone implant, no? And you can see that the implant is actually very soft, and its feel and touch is actually the same or similar to the usual or normal breast tissue. And the second type of breast augmentation is actually by the use of fat grafting, meaning we take fat usually from your tummy or from extra fat from anywhere in your body. We harvest it, we get it from there, and then we process it for a short time, and then we inject it on the breast area in order for us to achieve or to gain a more youthful and a better looking breast. No? So those are the two main types of breast augmentation. And sometimes there are also times that we do both, no? So we can insert an implant to augment or to enhance the shape of the breast, and also perform fat grafting at the same time, so that will achieve a better contour, no? Especially on the areas that we cannot augment with the use of implants alone, no?
So, Dr. Gerald, how long kaya yung downtime o yung recovery after na magpa-breast implant? So,
Yeah, very.
Kailan siya work, back to work, ganon?
Correct. So very good question, and we get this a lot from our patients. The usual downtime is actually about 1 to 2 days only, no? Minsan nga we say that it's a weekend recovery type of procedure. So we do like a procedure on a Friday or a Saturday, and by Monday you can actually go back to your normal work. You can do light work, like light office work. No, you can walk around. You don't have to be, situated in your bed and recovering, because this is a very fast recovery type of procedure. However, it should be important to know, no, na dapat within the next 6 weeks after surgery, you cannot perform any heavy exercise or heavy cardio exercise. So if you're an active person, like you like doing jogging or running, no, for cardio exercise, this should be refrained, no, from being done for about 6 weeks after surgery. So, it generally depends on how you want to say yung kung ano yung downtime mo. quote unquote, but usually about 1 to 2 days is good enough for your recovery or back to normal work or light work na.
Yun. So, Doc Gerald, will breast augmentation, always the question kasi ng mga patients will breast augmentation increase their chance na magka-cancer on the
Right.
breast?
Very good. Yeah, very good question then, no? So there are long-term studies already uh, for patients who've had breast augmentation, and this does not increase the risk of developing cancers. No? So again, the breast augmentation, we put either silicone implants underneath the breast tissue. So and that that the implant itself is not it does not seep or go through to the breast tissues, no. So no, it does not increase the risk of breast cancer. The same thing for fat grafting. Even if we inject fat on the breast tissue itself, no, to shape the breast, it does not increase the rate of breast cancer. But sometimes there are some increased rate of cyst formation or parang mga benign na cysts kapag nag-fat graft. But these can be managed naman conservatively or with monitoring after the procedure. No, but generally breast cancer does not happen after breast augmentation, unless you have an increased risk already for breast cancer.
And yan, di ba, ang breast augmentation before, parang inisip ng mga tao, it's because yung mga young people want to have bigger na breasts. Pero in actuality, there are some people talaga na syempre as they grow older, mas nagiging nagsasag yung breast. So how will you know if am I too old to get breast augmentation, or may certain age ba na hindi na siya recommended?
Yeah. Okay. So actually, there's no maximum age to get breast augmentation. Although you are right, no, Amy, that there are certain age, no, especially if you turn into like 50s or 60 years old, that there's you lose the breast volume, and then you also get these droopy breasts because the skin loses its natural elasticity as you age. No, so for these patients, what we do, aside from just putting implants, is we do a breast lift as well. No? So it's called mastopexy or a breast augmentation mammoplasty. No? So we tighten the skin, no, surrounding the breast, and then also we can either put either fat graft or an implant, no, to augment or to increase the volume of the remaining breast. No, so this is very typical for yung mga ganyang age, yung mga 50s, 60s, and it's actually usually packaged what we call mommy makeover, quote unquote. No? So aside from the breast, these mommies or those who've already have children before, and then these children have already grown and are now like young adults already. It's now their time to actually focus on themselves. So that's how they reward themselves. They feel that it's now time to focus on their own well-being. So they either get this breast lift and breast augmentation as well, and then also sometimes we package it with like a tummy tuck or something that would contour the body then. So after. So
talagang after surgery talaga na makeover na ang mommies.
yes, correct.
So for yung mga younger naman na women who wants to get breast augmentation, should they wait ba na matapos na sila sa childbearing bago sila magpa-breast augmentation? Kasi baka syempre may concerns sila na baka hindi na sila maka-breastfeed, mga ganun. Meron ba siyang factors to consider?
Yeah, so there are a lot of factors, especially for young women. No? So breast augmentation does not go without risks. But generally, if you plan to get breast augmentation, it's better to consult your plastic surgeon because, again, if you have breast augmentation prior to having babies, the chance of you get breastfeeding is still there. No, so it doesn't get affected. You can still breastfeed even after you've had breast augmentation because we don't normally go through the breast itself. So we go under and we insert the implants under the breast tissue. So the capacity ng breast tissue mo actually to produce milk is still there and you can still breastfeed. No? However, after breastfeeding or after pregnancy, you have sometimes your breast actually droops or you have parang a more lax breast tissue, no? So sometimes it goes down, no, pababa towards um, in front of the implant, and that's the time that there are some revision surgeries that needs to be done after you're done breastfeeding or after you're done having children, no? So but generally there are no like contraindications to getting breast augmentation when in the childbearing age or parang when you're still young, no? So there.
So yung next question natin is, magbabago ba yung nipple sensation after breast augmentation? So we'll answer that question when we come back. And we're back again here at MugPahaba ng Buhay. This is Doc Emy, and our topic for tonight is about the boob job. And our guest is Dr. Gerald Episamis. He's a plastic surgeon. So yung last question natin before we took a break is, ang question was, magbabago ba yung nipple sensation kapag nagpa-breast augmentation na tayo? Kasi syempre, we know that the breasts are part of our happiness in life. So, Gerald, ano po yung masasabi niyo about this?
Yes, correct. And it's a very important question. And a lot of patients actually ask about this. And it really depends on what type of breast augmentation you get. So we usually, it really depends on kung saan yung incision that we do. No? So there are some surgeons who does a periareolar incision, meaning we go around the nipple to insert the implant. And when they do that, sometimes the sensation to the nipple gets affected, and that's the most common complication for that type of breast augmentation. However, there are other types of breast implant surgeries where we go under the inframammary fold or parang where the breast actually dun sa ilalim na fold, no, ng breast, no? So that incision, yeah. So that incision is actually hidden naman, no? That scar is hidden, but the good thing about it is that the nipple sensation gets preserved, no? Because usually hindi naman natatanggal yung nerve that actually supplies sensation to the nipple, no? So the answer siguro to the question, Doc Emy, is it really depends on the technique and also depends on the surgeon. But generally, no, breast augmentation does not affect nipple sensation. However, there are some patients who experience hypersensitivity actually after breast augmentation, but this is temporary and usually resolves in about 2 to 3 months after. So,
Dr. Gerald, is yung breast augmentation, is it permanent?
yeah, so a good question again, no? Because breast implants are usually our foreign body, no, and they actually are they make breast implants now very well. And they have a lifespan. We call it a lifespan of about 10 years. No, but that lifespan doesn't mean that you need to remove them after 10 years. It just says that in about 10 years, there are increased risk of either implant rupture or nagbe-break yung implant, no? Or that the silicone inside the implant bleeds, or parang it gets out of the capsule itself. But it doesn't mean that it will happen to you. And these implants actually have a warranty. No? So the warranty means that it is certified that in about 10 years, no rupture will happen, and ganun sila ka confident about their implants. No? So lifespan in terms of number of complications happening, it's about 10 years. No? In 10 years, dapat you get screening for either an implant rupture, no, with an ultrasound. And that's why you need at least a yearly checkup with your plastic surgeon so that we can detect these problems early on.
Actually, may mga patients ako na may sasabihin nila na pa-breast augmentation sila noong 1980s, 1990s. But actually, yung ginawa sa kanila was a silicone injection. So, considered ba talaga tong breast augmentation to?
This is actually a very dangerous type of breast augmentation. No? So, again, in the early 80s and 90s, when silicone implants are still not as well developed, there were some time ago, and actually even currently, there are still some either fly-by-night practitioners who just inject silicone gels on the breast to claim it as proper breast augmentation. And this is actually very dangerous because the silicone gel can migrate, no, to the normal breast tissue, and they form these parang scarring or parang nagpepeklat, no, around it, because that's how your body actually reacts to foreign material. And sometimes, no, and actually a lot of times, these granulomas, parang peklat, no, in the breast actually gets inflamed because your body is trying to reject it, no, and then you get infections, and then you get deformities, o parang nagkakaroon ng kulo-kulubot na area on your breast. And I have had a lot of patients who've had this done, which we needed to reconstruct, no, as part of being a plastic surgeon as well. Not just, enhancing the breast, but we need to reconstruct the breast because we needed to remove the whole breast and then make a new one just to address this problem. So again, this is very dangerous, having these silicone injections, and hopefully nobody falls to these bad people out there.
Even yung patients that I see, even if sabihin natin hindi sila prone to cancer, but it's so difficult to screen them already kasi parang ang nangyari, kumbaga parang naghalo yung breast tissue and yung mga silicone implant na in-inject. So it's so hard to monitor them and to screen them for breast cancer. And tama yun kasi yung iba-iba nilang mga orange, yung mga breast nila, parang mga bato na yung itsura. So parang eventually, hindi na sila naging happy sa kanilang mga breast.
Correct. And there are some reports that actually these patients transfer their lesions transform into cancer. So it's very dangerous.
So I think, Doc Gerald, a lot of our netizens have a lot of questions. I'm curious yata sila. So we'll take a short break and then we'll answer all their questions when we come back.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, manipasyon, eyebrow embroidery.
Hello, we're back again here at Magpahaba ng Buhay with me, Doc Emy, and today our topic is about the Boob Job, and we have our guest, Dr. Gerald Abisamis, a plastic surgeon from the Philippine General Hospital. So ngayon, we're taking the questions from our netizens. So first question is from Marie of Davao. Meron siyang breast cancer at tatanggalin daw yung suso niya. Paano po magkakahubog ulit ang suso ko? Magkano ang dagdag na ihahanda ko para dito?
Okay. So ang tawag na actually, it's not just the breast augmentation. No? What that patient needs, so si Marie would need a breast reconstruction. No? So breast reconstruction is the creation of a breast mound, no, after removal of the breast tissue, no. So especially after cancer surgery, or if kailangan siyang tanggalin dahil sa cancer, kailangan pwede nating i-reconstruct yung inyong dibdib, no, para magkaroon ulit ng panibagong hubog ng breast, no. And we do a lot of different types of breast reconstruction. Pwede rin siyang ulit implant-based surgery, same as breast augmentation, where we can insert an implant under a breast pocket kung may enough skin na pwede nating gamitin para doon sa breast implant, no? Or pwede rin siyang fat, or parang taba ay ilalagay, no? Or pwede rin siyang flap. Ibig sabihin, kukuha po tayo ng either taba at laman galing sa ibang parte ng katawan, no? Pwedeng sa tiyan ng manggagaling o kaya sa likod, sa back, no? And we swing it, no? So iuurong natin papunta sa dibdib para magkaroon ng panibagong hubog ng dibdib, no, after surgery. And usually it really depends on how much this would cost. It ranges from about 70,000, 80,000 up to 150,000 to 200,000. So it really depends kung anong type ng surgery. So I think the most important thing is to have a consultation with a plastic and reconstructive surgeon.
Yeah, actually, itong mga services na to ay available even sa mga public hospitals. So actually like PGH, mga yes, they actually are available. Yung babayaran nyo lang po ay yung implant na ilalagay. So I think important yun na maalala ng ating mga patients kasi baka isipin nila na ay kulang naman yung pondo ko, hindi sila
Yes, and even PhilHealth and actually some HMOs, they cover this type of procedure, no. So it really depends on sa HMOs, it depends on the coverage that you have, but for PhilHealth, generally breast reconstruction is part of their coverage for these patients.
Ang next question natin, Doc Gerald, is from Anna of Cavite. So yung question niya is magkano po yung ginagastos for breast augmentation and kung covered po ba ito ng card?
And so unfortunately, no, breast augmentation is part of cosmetic or aesthetic surgery. So usually these are not covered by your HMOs or your cards, and even PhilHealth, no, because this is part of enhancement of your body, no. So yun, unfortunately hindi. But the packages, no, so usually these are out of pocket packages, no, that usually includes your hospital fees, surgeon fees, and anesthesiologist's fees, no. Usually range from 120,000 up to 160, 180,000, no. And I think the most important thing when you have breast augmentation is that you have it done by a board certified plastic surgeon, because at least you know that the quality and the safety of your of the procedure is being done, no, with the utmost patient safety in mind, no.
Okay, thank you, Doc Gerald, for your time this evening. And I'm so sure maraming natutunan yung netizens natin about breast augmentation and yung safety nito. So do you have any last words for our viewers?
So siguro, good evening everyone, and I hope everyone stays safe. We've had increasing number of COVID patients now, so hope everybody just stay safe and
thank you so much, Doc Gerald, for your time. So for those interested for breast augmentation, make sure that you consult a board-certified plastic surgeon. So thank you very much again, everybody. As the expert, health is a state of body, wellness is a state of being by Jay Stanford. Thank you mga ka-mugshots and see you every Tuesday at 6 p.m. Ako po si Doc Emy dito lang sa Mugshots Now, magpahaba ng buhay. Keep safe and God bless everyone.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, Andy Passion Eyebrow Embroidery,